Hello viewers, welcome once again to my EMTCH channel. I'm going to discuss about modes of delivery for a woman who is HIV positive. So when we are about to discharge you from antenatal care, we shall have helped you make an individual birth plan. An individual birth plan is just something that you do choosing your facility of choice where you'd want to go and deliver, preparing your baby bag. It's just a bag that you hang on a wall or put somewhere, so you start dropping 1, 2, 3 inside, like baby care products, maybe soap, baby oil, nappy liners. Nappy liners are very important because they are very soft. They can be used for cleaning your baby. Baby shawls, and all the things that you want to use on your baby. You can also drop a torch with battery inside. Remember, some people call labor pain a tragedy, but tragedies never ring any bell. Labor pain will come at any time. Maybe there's a blackout, you'll need your torch. You're supposed also to identify someone who will escort you to the hospital when you are in labor pain. Yeah, so we shall have helped you make an individual birth plan. Then when you come to us, you are in labor. There are some organizations that prefer some modes of delivery for certain women, like maybe if you're viremic, some organizations prefer that you go for cesarean section. Viremic means that you have a high viral load. Yeah, because cesarean section, the doctor makes sure that your baby is handled very fast and cross-infection is prevented. Your blood and that of the baby do not mix at all. But don't worry about that. Midwives are trained currently on how to handle mothers who are HIV positive who come in labor. So what do we do when you come in labor and we've known that you're a non-positive? There are things that we do to make sure that you have your baby safely without infecting them. First of all, what we will do, we will make sure that the number of vaginal examinations that we are doing for you using our fingers are reduced. For a mother who is not positive, we can even check you 4 times. Remember that your cervix is supposed to dilate to about 10 centimeters for the baby to come out, for you to push. So we need to keep on checking how far you've gone. If you're HIV positive, we'll minimize the number of vaginal examinations that we'll be doing. Then there are some mothers who don't have enough strength to push the baby. In such situations, sometimes the doctor will use some metallic equipments that are curved to get hold of your baby and pull the baby out. If you're HIV positive, we don't do such invasive procedures. So why are we avoiding many general examinations using our fingers and such invasive procedures? It's because we don't want to cause trauma to the birth canal, to the vagina, to be precise, because we don't want you to bleed unnecessarily because your blood is infected. We don't rupture the amniotic fluid artificially because the amniotic fluid protects your baby. So we let you push the baby in the sac, and if it ruptures on its own, there's no problem. Then we make sure that when we are cutting the cord, we cut it very fast, and we cut it in a way that your blood does not mix with that of the baby. Then immediately we give the baby prophylaxis, and then from there we'll start doing postnatal care for your baby and yourself. So I want to talk about viremia, people who have high viral load. What causes this? First of all, I want to talk about something that is very sensitive to our clients, to people who are on ARVs, and this goes to the general population. When you start taking your ARVs, when you test negative for the first time, we will put you on ARVs. You'll take them for 3 months. Then after 3 months, you will come. We will do for you a viral load check. The first viral load check is just baseline. We do not know the quantity you had before you started taking your ARVs, but we expect the viral load to go down, and after some time for it to be undetectable, so that when we do for you a viral load, it is just undetectable, or maybe below 50 copies per deciliter of your blood. So some people, when they've been on care for some time, and every time we do for them a viral load check, they are constantly having undetectable levels, they become curious. And they go for HIV test. Do you know that if you are having constant undetectable level of the viral load, sometimes you test negative when you go for HIV test? So why are you negative? You are negative because you are adhering properly, and that's a congratulation. So don't start thinking that, oh, I think the first test was not done properly, I think I'm just HIV negative. No. When you're taking your antiretrovirals, there are some parts of your body that the ARVs cannot reach. Those parts of your body, the virus will hide there, but the virus will be inactive, not doing anything to you. They're just there, they're not killed. So undetectable viral load means that the viral load is suppressed. Not that the virus is killed. No, the virus is not killed. The virus can hide in these sites. They're called sanctuary sites. So the sanctuary sites, the effects of antiretrovirals do not reach there. But if you continue taking your drugs properly, you'll just remain negative. You'll live a normal life. You'll not be able to transmit HIV because U is equal to U, undetectable is equal to untransmissible. You will not be having any kind of opportunistic infection like maybe cough or spots on your body, or maybe herpes zoster. You'll not have those problems at all. You'll not even lose weight. But now some people, when they test negative after having this kind of viral suppression for some time, they stop taking drugs. So what happens when you stop taking your drugs? I said that the virus is not dead, but just inactive. The virus will realize that you've stopped taking your drugs. The virus will become active. The virus will start replicating. The viral load will go up so fast. When the viral load goes up, the CD4 cells count go down. The CD4 cells are the white blood cells that help you fight the HIV infection. So that means that when the viral load is undetectable, the CD4 cell count goes high because nothing is destroying them. They get destroyed when the viral load is high. So when you stop taking your drugs, the CD4 cells go down. So when your body is not having strong immune system, you'll start developing opportunistic infections like TB. You'll start developing all kinds of problems. Then when you come to us, sometimes when the virus becomes active after you stopping taking your ARVs, sometimes the virus becomes resistant to the drug that you are initially using. So after some investigations and follow-ups, we will have to change it to second line. Then there are some people also who don't stop taking these drugs completely, but they just go for what we call drug holiday. They say that, oh, I'm doing so well, everything is okay. Every time I'm tested, I have an undetectable level of viral load. So I want to rest for 2 months. I don't want to take my drugs every day. I want to rest for 2 months, then I will start taking again. The same thing will happen. When you stop taking your drugs, the viral load will go high. The CD4 cell will go down, and you'll start having problems, and you can also develop resistance. So you can live a very, very, very normal life. In fact, it's a very normal life. It's like you're not even having HIV if you take your drugs properly and every day. Sometimes if you have a question, if you are curious, just discuss it with your healthcare provider. Anything that you want to do, please involve them. Do not stop taking your ARVs, and do not skip. Most of the time, people who are viremic are people who skip their medications. If you're very honest, you'll tell the truth. Maybe you are in a busy occupation. Sometimes you miss taking your drugs. It is not right. So you're supposed to choose a time of the day when you'll make sure that you take your drugs. Maybe at 9 p.m. Most of people go to bed at around 9 p.m. before you go to bed. you take your drugs. Another thing that makes people not to take drugs properly is non-disclosure. Now you are HIV positive and you've not told your partner. You are scared. You think if you tell them they'll break up with you. You can tell us so that we help you in disclosure. We are trained on how to help you with this. It is very important to disclose, because like a mother who is HIV positive has had a baby, remember that you have to give your baby prophylaxis every day. You also need to take your drugs every day. How will you take your drugs? How will you give your baby drugs if your partner does not know? Will you be able to hide this from your partner all the time? It's a very hard question maybe, but very simple. We can deal with it. So in my next video, that is what I want to handle. A mother has delivered. You've had your baby. How do you take care of your baby? What is your role as a mother? What is your role as a partner of a mother who is HIV positive, who has had a baby? And what is the role of the healthcare worker? How do we take care of this baby until complete cessation of breastfeeding? Why am I talking about complete cessation of breastfeeding all the time? Is because breast milk has some virus in it. So you have to breastfeed your baby for those who opt to. Every time you breastfeed your baby, you expose your baby to infection. So that means that this baby is exposed for as long as you keep on breastfeeding him or her. That's why I'm saying that we have to take care of this baby, do a follow-up until complete cessation of breastfeeding. Thanks for watching. Share, subscribe, so that when I do the next video, you are informed. Bye for now.